Hi, I'm Samantha Neely and I'm with my client Lacey, and today we're going to be measuring her blood pressure, body composition, and flexibility. So first we're going to start out with blood pressure. I'm going to be using a blood pressure cuff with a sphygmomanometer and a stethoscope. This is the manual way to measure blood pressure. There are also machines that will do it automatically on a digital machine, but we're going to be doing it manually today. So we're going to want to put the cuff, you can just go ahead and relax. She's been sitting down for a while, so we have her true resting blood pressure. And what we're going to do is we're just going to find her brachial artery to begin with. So it is going to be on the medial side of the arm. I'm going to feel around until I feel that pulse. And we have it right there. So that's where we're going to want to match up our artery line on the cuff. I'm going to begin by putting the cuff on. Oops. And I'm just going to be sliding that down her arm. The artery line is right here. So we're just going to match that artery line with that brachial artery. Once again, feeling around to find it. Right there. All right. I'm just going to fasten that. I don't want to do it too tight, but also not too loose. I want to make sure that it's not moving around on her arm. That's secure. All right. And then we've got this sphygmomanometer, and we're just going to attach that to the cuff so that I can see it as I'm taking her blood pressure. All right. Oops. I'll reattach that. All right. Got my stethoscope. I'm going to be putting that in my ears, and I'm going to be placing the head of the stethoscope right on that brachial artery so that I'll be able to hear. I don't want to put it too far under the cuff to add excess noise, but I want to put that just right below the cuff. Then I'm going to be holding the pump right here, making sure that it's completely sealed off, and we're going to be pumping up the amount to about 140 to 160. And then we'll just be listening for when I start to hear a pulse, and then the bottom number of blood pressure will be when I begin to hear the pulse go away. The top number is diastolic when the heart contracts, and the bottom number is systolic when the heart relaxes. We're just going to slowly let go of that. All right, so on my reading, I got 90/60. Is your blood pressure normally pretty low?
Yes, it is.
All right, 90/60 is a low blood pressure considering that the average is 120/80, but the averages differ from person to person, and the main concern is high blood pressure. So as long as she doesn't feel dizzy or weak or feel like she's going to pass out, that's just something that we need to be aware of, but not necessarily concerned about. A common mistake about taking blood pressure that people make is watching the little stylus, watching that try to follow the pulse, and that doesn't necessarily mean that that's when you start taking the measurement. You need to listen for the actual pulse through the stethoscope, and when it disappears, we can't just rely on the visual pulse on the sphygmomanometer. The next assessment that we are going to conduct is the YMCA sit and reach test, which measures flexibility. It involves a yardstick on the ground with tape marked off at the 15-inch mark, which the subject, Lacey, is going to put her heels at the tape. So go ahead and sit down. Lacey did a series of hamstring and lower back stretches before we started, so that she's nice and loose. As you can see here, the yardstick is as so, and a couple things before we start the test. We're going to make sure that the subject's hands are right on top of each other. A lot of the time they're going to want to slip and reach farther with one hand. So we're making sure that her hands are right on top of each other. We're making sure that her knees are staying straight the entire time, not wanting to bend as she reaches. And that she is not doing a ballistic stretching motion as she is reaching. So we're going to make sure that her hands are touching the yardstick at all times. And let me just adjust this camera angle so that we can see as you're reaching. So go ahead and reach as far as you can go. Nice job. That's at 17 inches. You can go ahead and let go. And go ahead and reach just one more time. Touching, making sure your knees aren't bending. And that's at 17 inches again. So that's pretty accurate to what her test is. You can go ahead and let go again. Now, according to the table in the book, 17 inches is equivalent to about 43 centimeters, and in the textbook the table says that 43 centimeters for an adult, that's 52, is excellent in flexibility. The next thing that we are going to be assessing is body composition through a series of assessments. The first assessment is looking at hip to waist ratio. And for the waist, which we're going to be measuring first, we're going to get a tape measure, and we're going to look at the smallest portion of her waist, which is right here. And I'm going to just be putting this nice and even around the entire circumference of her waist and see where that measuring tape overlaps. So please come closer to the camera so that we can see the measurement. I'm going to be using centimeters to measure this. And I'm just going to go all the way around, making sure not to pull too tight or make sure it's not too loose also. So as we can see here, it is at 76 centimeters. You can see that. And that is the waist measurement, 76 centimeters. Now we're going to move on to the hip measurement, which is going to be the largest part of the hip. So can you go ahead and turn to the side for me? And as we can see, the largest portion of the hip is going to probably be right here. So once again, I'm going to be using the centimeter side of this tape measure. I'm going to put it on the largest section of the hip, making sure that it's even all the way around. Making sure not to pull it too tight. And we are at 102 centimeters, which you can see right there. And that is going to be the hip measurement. The next portion of the body composition assessment is going to be measuring skin fold thickness with this skin fold caliper. And this is just really going to measure the adipose tissue, so we're not looking to grab the muscle, and we're also not going to be so superficial where we're only grabbing skin. Since she is a female, we're going to be using the triceps measurement, the superiliac measurement, and the thigh measurement. First off, I'm going to mark off the different areas that we are going to be putting the skin fold caliper on. The first area is the tricep, so go ahead and turn around for me. And where we're going to measure on the tricep is about half the distance between the acromion process and the olecranon process. So I'm going to just feel that out for you. All right, the acromion is right here, and then the olecranon process is, go ahead and bend your elbow for me, is going to be right here. So I'm going to measure from here, the acromion, to the olecranon process, which is 14 inches, and I'm going to put my finger right at 7 inches because we're looking at half the distance. And then I'm going to mark that just with a washable marker. All right. The next area that we're going to be looking at is the suprailiac measurement, which is going to be at the anterior axillary line just above the iliac crest. So there is a natural diagonal that follows the iliac crest, and we're going to find that. Sorry if it tickles. And once we find that, we're going to go just right above it at the belly, which is going to be right here. All right, and then our last measurement is going to be on the thigh, so I'm going to go ahead and have you sit down. You can go ahead and put your shirt down for right now. And what we're going to do with the thigh is we're going to measure from the top of the patella to the inguinal crease, which is going to be just right here, that natural, oops. So we're going to measure from the top of the patella to the inguinal crease, which is that natural crease right here at the thigh. So once again, I'm going to get my measuring tape. I'm going to measure from that inguinal crease, making sure I'm kind of at the midline of the thigh, and going just to the top of the patella. So here, and that measurement is 18 inches, so I'm going to go right at 9 inches and put a nice little X right there. All right, now we are ready to use the actual skin fold caliper. So go ahead and stand up again. We're going to start out with your triceps, so turn around. And just go a little closer to the camera. Maybe a little farther away. Yep. All right. So as you can see, the mark is right here. The skin fold caliper, it measures in millimeters. So what I'm going to be doing is I'm going to be grabbing her, trying to be grabbing her fat. So I don't want to just grab the skin right here, and I don't want to grab the entire muscle. So I'm going to grab at a perpendicular angle on the belly. And go ahead and squeeze your tricep for me. All right, perfect. So you can let go now. Just having her squeeze your tricep to make sure that I'm not grabbing any of that muscle. And I'm going to be putting that right on midline. And that measurement is right at 20. So it was sitting right at 20 on the skin fold caliper. All right, now you're going to turn around and we're going to measure that suprailiac measurement. So we're going to grab, once again, the diagonal is here, so I'm just going to grab with that diagonal, making sure not to grab any muscle. And I'm putting that right at the middle of that muscle belly. We're sitting right at 18 millimeters on this measurement. And the last one is going to be the thigh, so go ahead and sit down again. And I am going to be grabbing the fat and not the muscle. Putting that right at the base of the fat. And this one is at 23 millimeters. All right, and that's our skin fold measurements. Next, we are going to be measuring joint flexibility, starting off with the elbow. We are on her left arm right now, and we're going to be using a tool called the goniometer, and it is just a tool that helps us measure the joint angles. So first of all, we are going to align the center of the goniometer with the lateral epicondyle, which is the part of the joint that we're measuring at the elbow where it's moving and bending. I'm going to put the immovable hand in line. Once I palpate the lateral epicondyle, I'm going to put the immovable joint in line with the humerus. The movable joint is going to be in line with the radius, and it is going to follow her radius up as she flexes her elbow. So I'm going to ask her to slowly flex her elbow up, and I'm going to have that hand follow, making sure that nothing else moves while measuring. And go ahead and go to your end point. Is that your end point?
Yes.
All right. So we're still at the lateral epicondyle. And if I'm going to move a little bit closer so that we can see the measurement on here, she was able to achieve a joint angle of about 145 degrees of elbow flexion on her left elbow. Now we are going to measure the exact same way on her right elbow. Next, we are going to measure the flexibility of the shoulder when it is being flexed. The center point of the goniometer is going to be at the humeral head, and the movable part of the goniometer is going to be in line with the humerus. The immovable part is just going to be a continuation of the midline of the body. I'm going to keep this stationary at the humeral head, and I'm going to ask her to gently start to lift her shoulder up with her elbow continuing to be straight, not bending her elbow, and she's going to go all the way. So go ahead and lift into flexion all the way back as far as you can go. Is that your endpoint?
Mm-hmm.
All right. So I'm going to try to hold this and bring the camera closer. If we can see here, she is at 170 degrees of shoulder flexion. Next, we are going to be measuring hip flexion, and at the hip, we're going to be putting the fulcrum of the goniometer right at the greater trochanter of the femur. So I'm going to palpate for that, and I'm just going to have her flex her hip just to make sure that I'm finding that correct spot. So go ahead and flex your hip, looking for that point of where the joint rotates. Go ahead and put your hip back down. All right, so we're going to put the fulcrum right here. The immovable hand of the goniometer is going to be in line with the rest of her body, and the movable hand is going to be in line with her femur. Now, slowly, I'm going to have her flex her hip, but I'm going to ask her to make sure that her knee is bent as she's flexing her hip. If her knee is straight, that is another form in which to measure hip flexion, but that is also involving the flexibility of the hamstrings, and I don't want to be measuring that. I only want to be measuring the flexibility at the hip. So I'm going to ask her to bend her knee so those hamstring muscles are on slack. So with that said, we're starting right here, and go ahead and flex your hip up and making sure to bend your knee. Go as far as you can, bring your knee to your chest. Alright, can you go any farther? Alright, right there. So I'm going to stop her right there because I feel her pelvis wanting to tilt, and that is going into pelvic rotation and lower back stuff, and that is not measuring hip flexibility. So we're going to stop right there. We're going to look at the goniometer, and the goniometer is right at about 90 degrees of hip flexion, and that is on her left hip. We will do the same thing for her right hip. And the last measurement that we're going to be taking with the goniometer is the measurement for knee flexibility. I'm going to be measuring knee flexion. The fulcrum for this measurement is going to be on the lateral epicondyle of the femur. So we're going to palpate for that. This is on her right leg since she is face down. So once we find that lateral epicondyle, I'm going to go ahead and put the fulcrum right there. I am going to be putting the immovable hand in line with her femur, lining up with the greater trochanter of her femur, and I'm going to be putting the movable hand in line with her lateral malleolus, so in line with this malleolus right here. And once again, I'm going to ask her to slowly flex her knee, and that movable hand is just going to go along with it. So go ahead and flex your knee slowly and just bring your heel to your butt as far as you can. Good. All right. She's reached her end point, so I'm going to pull that away. And it looks like she is at approximately 138 degrees of knee flexion. That is for her right knee, and we will do the same measurement for her left knee.